I've had patients with severe pain who have asked persistently for euthanasia, and we've said, we can't do that, but work on your pain. And to have them weeks later say, I'm so glad that euthanasia wasn't an option, because when I was in so much pain, I was so desperate for it, and now you've got it under control, and I'm so glad to have this time. I'm really loving this life and this time at home. And that's a great thing. I'm a palliative care physician, so I look after the dying, anyone with a terminal illness, helping them with whatever troubles them, including pain and symptoms. In this law, it says that people are eligible if they have unbearable suffering. We imagine that that's terrible pain, but it needn't be. It may be that they find themselves in what they think is undignified circumstances where they can't toilet themselves, where they have no pain or no physical suffering. I had a man who had cancer in his arm, and his arm had been amputated. So he had one arm and walking around on his legs, and then got cancer spread to his spine and paralysed his legs. So he had just one functional limb, and I went to see him and I said, oh, that's really tough. And he looked me in the eye and he said, this is nothing compared with the suffering when I had depression. And that hit me. How mental illness, and particularly depression, can be a major component in people's suffering. And if we're missing that and not treating that, or taking that as being a normal part of dying, then these people are missing out on life and good quality life. Most of the doctors working within palliative care are opposed to this. We have always been people who've helped, and killing people is different to what we signed up for. Many of us said an oath, whether it was a Hippocratic oath or a similar oath, to care for people. And it just changes how we see the role of a doctor as both a healer, but also now a life taker. This will change patients' trust of doctors. I've had a patient already a little while back who their doctor spoke a lot to them about euthanasia and said, oh, it's a pity it's not yet legal, and then started increasing their dose of pain relief, which they thought was unnecessary. So they got very scared and left hospital as quickly as they could because they were concerned that their doctor was trying to hasten their death. And whether that person was doing that or not, I don't know, but it certainly scared the patient and would make them not want to return to hospital. Treatment for suffering is already legal in this country. Doctors can use pain relief, can use other medications to ease suffering, and if all the standard treatments fail and there is nothing else that will relieve the suffering, palliative sedation can be used to ease the suffering of a patient without ending their life. And I want people to know that they matter even when they can't function as they used to. People are important, whatever they can do.